Reykjavik, and there I'm a coordinator for a program or a project or a way of working that we call Together Against Violence. And I guess that's why I'm here now today. Mr. Danilo Ballotta is a policy analyst. He's been working for more than 25 years in the field of international drug policy, working for the European Monitoring Center for Drugs and drug addiction. I love those very simple names. And over the years, he has participated in hundreds of EU and UN committees and policy events. I would love to be able to say the floor is yours or the stage is yours, but Mr. Ballotta, Zoom is yours. Welcome.
Thank you very much. Thank you. Pleasure to be with you. If something is not working, please interrupt me and let me know. For example, if my voice is not good enough or if my slides are not going through. Thank you for this second opportunity. Yesterday, I was in Brussels. I had to connect from there, but we got evacuated for the sad events there. So I'm in Lisbon now. Well, thank you for the opportunity to talk about human rights and gender. It's really something we got a sort of momentum to talk about this. So it's a good thing you have done this today. I share my presentation. Please tell me if something is wrong and you don't see it. Well, the presentation you have did it of me already. I have a quite long experience in the same field. It's basically European and international drug policy, and I say that I am one of the dinosaurs of this field. But this unique situation gives me the possibility to see the evolution of certain trends. And this is what I will bring you today. I will give you some data, some facts, but also I will contribute.
Excuse me, Mr. Ballotta, can you enlarge the slides, please?
Enlarge?
Yes, make them bigger on the screen.
Okay, how I do that?
Mr. Ballotta, do you have two screens?
I had two screens. Now I have only one. I swapped into one. I can share again.
Yeah, I think you have to share them on that screen now.
Okay.
Yeah.
Is this better now?
That's working. Great. Thank you.
Okay. Thank you. Thank you for telling me that. So was I saying I will show, I will put you some data there, but also I will use my experience being part of the council working group of the EU, where decisions basically are taken, but also following the Commission on Narcotic Drugs for almost 20 years now. My presentation of today is how the EU sees human rights and gender in drug policy, and what are the latest developments in this area. But I want to start first with telling you what is that we as a drug agency see as the EU drug situation at the moment. And maybe the two things are connected, the drug situation and why we need a focus on human rights. The situation is can be summarized with this: is indicators are on the rise. All indicators are giving us the feeling that we are at the top of a situation and in which the decrease is not yet at sight. So we are seeing incredible and enormous amount of cocaine, mainly coming from Latin America. We do not see yet, actually the situation from Afghanistan of heroin is kind of complex, because we have seen a rise of heroin coming and an overproduction year after year in Afghanistan. However, we know that the Taliban have issued a ban on opium, which at the moment we do not see the effect of it, but is something that is concerning us. And then cannabis, which is the most illicit drugs consumed, is produced widely within the European borders. Hashish is coming very potent from Morocco, and there is a lot of adulterated cannabis, synthetic cannabinoids, also present in the market, in the cannabis market. So it's a really heterogeneous market. As I say, we see much availability of drugs that we were seeing in the past. Cocaine is one, heroin is one. The green part in the heroin seizure is Turkey. So you see how much the route from Afghanistan via Turkey to the Balkans is very, very powerful at the moment. And cocaine is basically affecting the north ports of Europe, like Antwerp and Rotterdam. We have new phenomena that were not here 10 years ago. For instance, we produce within the EU cocaine. We have now dismantled more and more laboratories every year, and we see that there is a pairing between criminal organization of the European, based in the European Union and based in Latin America, to establish here in Europe laboratories that basically have the same skills and the same possibilities of labs that normally were located in other parts, in Colombia, for instance. And crack use is also something that is very relevant in many European towns, attracting the most vulnerable, the most marginalized users. So it's something that is concerning and something we see more and more appearing where before this phenomenon was not there. This is probably because, you know, it's an effect of the quantity of the important availability of cocaine we have in Europe. Cannabis, I already said that to you. The problem we have cannabis is high level of THC, as you can see in the two slides. Prices that basically have remained the same, and important numbers of people entering treatment because cannabis toxicity. And we think that many of those have encountered adulterated cannabis with synthetic cannabinoids, very potent and very toxic. And of course, consumers are unaware about what they are really consuming. If we talk about NPS, new psychoactive substances, we see that we are in a situation better than they were in 2014-15, when we were detecting many more new substances. This chart, this bar, is about any new molecule that appear in the market and is detected and is communicated to us. And after the legislation that has been introduced in the EU, but also in China, which is the main producer of chemicals for this sort of market, we are at the situation of one new substance per week in the European Union. Each week there is a new molecule that mimic the effect of another drug's illicit. And the problem here is that often these so-called legal alternatives are much more potent and much more toxic of the substances that they would like to replace. We have phenomena like methamphetamine, not big compared to the world, but still important, and located in few regions. Why and also we have data from Westwater's analysis, which are there, that tell us where the market is located. Why we are concerned even if this is a very kind of low phenomena compared to cocaine or others, is because the attraction of methamphetamine in those parts of the population, particularly vulnerable, particularly marginalized, for the very often low cost of this drug, but for the high impact on social, mental, and public health. So it's something we are really giving attention to. On overdoses, we are stable. We have to say that probably the systems that are in place, the treatment, the harm reduction system in Europe, have defended us towards this tsunami of drugs. We do not have the numbers that exist in the United States, for instance, very far from it. We are talking about 5,000-6,000 drug overdoses deaths a year. There we are talking, as you know, about 100,000. So, but why we have this objective and this ambitious that we could decrease enormously these deaths. These are preventable deaths, are aging drug users, or are experimenting drug users with very powerful synthetic drugs. And we believe that through prevention, through harm reduction, if we would increase at the member level the access and availability of services, this is a number that could go down. And why all this? Because money. The market, the European market for drugs, is one of the most lucrative illicit markets of all, probably more than the weapons, than other really illicit activities. And this is why it's so flourish, because the money, because the enormous gain that criminal organizations can make with drugs. This has attracted a new phenomenon that we were not used to: violence. We were not used to see scenes almost Mexican or Colombia style, with cartels fighting each other for the control of this lucrative market, and victims and civilians caught in crossfire for the control of this very, very lucrative market. And we are at the height of it. What we see is what is currently happening, and it's probably what will happen in the next years. So we are really at the epicenter of the situation. This as if there is one good consequence of this, is that politicians have understood that there is a need to do more. In my almost 30 years of experience, I see drugs very important in the policy agenda during the 80s, the 90s. Then it went really down, like it was not important at all, probably because the success of treatment and what we were putting there as a social measures. But now we have politicians much more involved, because even though the phenomenon is not visible like it was visible in the 90s and in the 80s, it is there, and we know it more. And there are agencies like ours that put their data, reliable, objective, about the situation that is really worsening. And therefore, politicians are understanding that, and they are moving that to action. How is that we respond to this, and how we have responded in the past? And this is really the EU approach, and as you will see, is different. It's different from as the EU has a very strong personality. It's like a person with a very strong character in the field of drugs. We have something to say, and we say it loudly, compared to other regions in the world, the Americas, the Asian, or others. First, in order to tell you how we see the phenomena, we have to see who we are. The European Union is not a federation of countries. There is not the president of the European Union like the president of the United States that can decide. There is not one single parliament that enacts legislation for everybody. We have 27 member states. It's like, think to the EU as a condominium. You know, we have the different apartments, And then there is one apartment with the administrator, the one that should think to the common rules. So, and there are rules that are taken by vote. You vote if you want, you know, a new cleaner for the stairs. If you want a new lights, you vote. And if someone does not agree, well, you will not have new lights in the stairs in the condominium. This is the European Union. In the field of drugs, and this is very important to understand, the power of initiative is not with the Commission, is not with us, with the institution, is with member states. Member states can decide whatever they want, almost, but legally they can legislate, make legislation in the field of drugs that do not have to be equal to others or do not have to allowed from Brussels. In fact, if you have heard, cannabis legalization is something that is at the moment shaking the European Union, with Malta and Luxembourg that have already passed legislation to legalize the recreational use of cannabis, and Germany that is about to do it. So how they can do that? Because they can, because they are free to do it. So we have nothing to say. Well, nothing to say. It's not that clear cut, but this is what is important to retain. The member state can decide what they want. And in fact, different exists. If you see these maps, this is the legislation about consumption for personal use. In left, you have personal use. Right, you have personal possession. What is important to understand here that each member state can do whatever they want with the penal law. Some penalize, some decriminalize, some other do not consider this to be an offense. And therefore you would say, okay, if is such a difference and there is so much difference among legislation, because, you know, legislation is also the consequence of the culture, of the social attitudes. It's really something rooted to the national characteristics. How with so many differences you can have a personal characteristics, as you have said at the beginning, that you have a very strong personality and you have a characteristics which is very, very unique. Well, it's because we meet a lot and we talk a lot. This is the Council of where I was supposed to be yesterday. This is the Council of the EU, where ministers meet, and well, ministers basically stamp what other people have decided. But below ministers, there are other groups like the HDG. This acronym is very important for your drug policy because it's the horizontal drugs group. Is where every month the delegation of member states plus the agencies, the Commission, the Council, they meet together and they talk and they discuss about drugs every month since 1998. So these create a sort of common understanding, even though, you know, people might come from different background, from different political party, from different views. We need to discuss what is our position for next CND, or what is our strategy. And therefore, we need to talk through and have a coordinated approach in order to have a single voice. Is what we want to have. We want to have common position because, after all, we are in a community. And how we have created this is that since the 1990s, actually since the 80s, even though there was no legislation, policymakers wanted to have common strategy, common plans. And in the last 30 years, we have had 13 strategies, action plans, in which basically we were saying, okay, in the field of addiction, we say this. In the field of security, we want this. These are our objectives. This is what we want to do. And then action plans with all the actions that member states should have implemented. And then evaluations, which are these red dots here, these red circles, that we're evaluating what we have done, projecting the new big things. So this is a cyclical thing for the last 30 years. That's why the discussion in the field of drugs is kind of mature. in the European Union because we discuss about it a lot. So it's not one-off. It's something regular. And in fact, the last one is the EU drug strategy and its action plan for the years 21-25. And basically, we don't have legislation in the field of drugs. There is no, main law, European law. This is the law. This is the soft approach. This is the frame for any actions made at the European level by member states. This is the book that they have to follow. And I will talk about the strategy in a bit because it's important to understand our personality. We are the only region in the world in which the strategy set on 3 pillars. We want to reduce demand, we want to reduce supply, and it's traditional in the Opium Act, probably in 1909, you have reducing demand, reduce supply. It's really traditional. What is not traditional at all is that we have harm reduction, which is a pillar, at the same value, at the same political rank of demand and supply. This is very important, and because he elevate harm reduction, and I say elevate because harm reduction is a policy that has been born as a child of minor value. There was a movie some years ago about this, and now this child is grow and is at the same level of his brothers or sisters, and this is important, absolutely important achievement of the EU, because we can stand without being being afraid to say we stand on supply reduction, we must stand on demand reduction, but we stand on those measures that help people recovering. And probably harm reduction is one of the proxy of a human rights approach in drug policy, because it's that measures that are more compassionate, that measures that while we want to reduce and eliminate drug addiction as a final goal, we take care of the most impellent needs now, which is keep you alive, making sure your HIV does not worsen, does not spread to others, etc., etc. The EU approach to drugs. Oh my gosh. Okay, sorry, I was kicked out. Are you seeing me?
Can see you, but not the slides.
Yeah, I mean, it's gone. I have to go back and take the slides again. Sorry.
Now we see them again.
Marvelous. Let's see if it works again. Okay, can you see it? Is there a page of the EU approach to drugs here?
Yes.
Okay, so I can continue. Please stop me, something goes wrong. So the EU approach to drugs of the drug strategy, we say is evidence-based, integrated, balanced, and multidisciplinary, and incorporate gender equality and health equity perspective. This means that any actions, any policy that should be taken at national level should be based on the best evidence available and should be balanced between drug supply and demand. And sometimes it's not in this way, even today in some member states or in some parts of policies. So we need to always remember what the EU approach is, what wisdom we want. And we include a gender equality perspective, which is very important in all measures, in new measures in drug policy. Sometimes it's forgotten, but we are there to remind this. The aim of the strategy, I read it to it because there is something, a philosophy in it. The strategy aims to protect and improve the well-being of a society and of the individual, to protect and promote public health, to offer a high level of security and well-being for the general public, and to increase health literacy. Kind of standard, right? Many strategies are there. But I want to attract your attention on the verb used. They are all positive verbs. It's to protect, to improve, to promote, to offer, to increase. You do not see here negative verb, to fight, to combat, to destroy, to annihilate, to reduce, you see, it's really the attempt to do something for someone, for something, and not against something. And those that have white hair like me in the room knows that drug policy started against something. And often the against something has been transformed in against someone. That's why today we are talking so much about human rights in drug policy, because in the past, drug policy has been against, has violated some of the basic human rights of the individual. Therefore, here we are correcting something. We are rebalancing the approach. We act also on the language, because language brings stigma. And we have changed in the EU strategy and in our documents how we talk about it. The drug problem has become a drug phenomenon. Drug user, drug addict, junkies, all the type of stigmatizing words have changed in people who use drugs. Drug abuse is the use of drugs. We do not use fighting or war terminology. Anti-drugs combat fight is the EU drug strategy. We think that this neutralization helps doing better. We do not consider the aim of a drug-free society. Why? Because we have seen the damages that the application of this concept have created in the past. For instance, this is normally linked to a zero-tolerance approach, which gives a radicalization of drug policy with all the negative consequences that this has brought. We want to, as you saw, protect, improve, promote. This does not mean that Europe, as population will say, is soft on drugs or is soft on criminal organization. Not at all. But we want to distinguish very well, if there is a fight, what is the center of it. We have a concept of principle, many concept of principle. I will talk about two in this talk: human rights and gender. I did an analysis. I took the strategies from the 2000 onwards, because there was not before, and I say how many human rights is mentioned. And you can see that is a pretty recent phenomenon. It's the last one mentioned 17 times human rights. But the drug strategy before was 9. And 10 years ago, well, no, 20 years ago, was only 1 reference to human rights. As you can see, what I was saying from at the beginning is a momentum, is something that is growing. And in very recent, last year, in December, under Czech Republic presidency, the Council of the EU, that room colored with the people around the table, adopted a council conclusion on human rights-based approach in drug policy. Basically, a document which indicate how human rights should be at the center of drug policy responses. I have to tell you, for what I told at the beginning, this is not an obligatory legislation. This is a political commitment that member states have taken, and is how to, in the future, approach new legislation and new strategies. Invite countries to implement measures that reduce discriminalization for drug users, reduce stigma for people who use drugs, increase the gender perspective and the gender equity in all measures. We know very well how treatment sometimes is male-oriented, or services are male-oriented, and how much we need to do still to have a proper gender equality approach and justice in treatment or in harm reduction services. Therefore, attention to women, and also to children. Member states are invited to promote alternatives to criminal justice system measures, and the importance has been taken and is taken in these years by the contribution of civil society to the development of policies, to the monitoring of policies, and to the evaluation of policies, including those associations with people who use drugs. And of course, as the EU, we are totally opposite, and in any case and in any circumstances, to that penalty and arbitrary detention. In the EU drug strategy, gender is also increased. As you can see, is in the last 10 years, really, that the gender issue made its own way. And the two numbers are the drug strategy and the action plan, that is with the references. And I say, okay, but what is that this document say? You see, the drug strategy in 2013 would make explicit reference to gender equality. But the last action plan, the one 2021-2025, that talks about ask member states of the EU to reduce barrier to treatment and other services, and identify those barriers. I don't know, maybe opening hours or childcare during the treatment. So these are all possibly barriers for women to access treatment. Enhanced treatment option, and launch outreach work. So we kind of woke up from a legislator point of view to the fact that there are needs that have been not really felt at this moment. And this is a page about the last Sweden presidency. It was last 6 months. They had a priority on promoting a gender approach in drug policy, and this is the final conclusion, in which really they make a lot of very good suggestions on how to move into a real gender equality approach in drug policy. This was the EU, but how we influence others, how we influence national member states, how we influence the international level. The national member states, we influence by osmosis. We talk to them, they talk to us. Each member state have a legislation, and even though it's not obliged to implement this legislation, writing strategies, writing legislation, these documents, these strategies, the Council conclusion are political commitment, and therefore they should be included. They don't need to, they are not obliged to, but we have seen over the years that these things, even though are not obligatory, they move, they are sooner or later implemented. At the international level, we do a lot of work in trying to suggest our approach, what you have said, what you have seen in our approach, in our way of understanding things, in our philosophy. And these are, many of you will know this book is what's happened in 2016 at UN General Assembly on special session on drugs. And this is the outcome documents. Our position in human rights was very clear. We wanted human rights to be included in the drug policy document, in the outcome document, and because we think it's an integral part of the international system, and they go hands in hands with the implementation of the international drug conventions. Therefore, you have the International Drug Convention, but also you have human rights, and they go hand in hand. They are not one lower than the other. And in fact, we have got human rights in this document, also thanks to the pushy position of the EU. Now, we have the midterm review of the 2019 Ministerial Declaration at the CND 2024, and we are asking again member states to comply with their obligation under international human rights. There are already the obligation. Now we need to ask member states of the world to implement those. And when we talk about human rights, we have a broad understanding with health, women, children, vulnerable member of the society, the communities, is all a package that we need to promote. And very recently, in April 2023, the Human Rights Council, which is a branch of the United Nations, made a resolution on...
Ballotta, but I have to remind you, your time is running out.
Yes, yes.
Thank you.
I have finished. What we need. So basically, as a conclusion, we have all the bases. We have all what we need. We need to implement them at global level for next year in Vienna at the midterm review. We need to implement and continue at the European level, but this is kind of, we are all convinced, but especially we need national and local projects that will implement all that we have created at European and international level, so that every legislation, every program, every project will have the component of promoting and respecting human rights, but also promoting a respected gender equality. And I am finished. Thank you very much. And I stop sharing.
Thank you so much, Mr. Ballotta, for putting this in this European context. We have some time for maybe one question, but I will have to ask you to come here so Mr. Ballotta can hear you. Any questions? Well, then we just say thank you for pointing out like important things like making drug policies, emphasizing human rights and gender. There is one question. Sorry, of course. There's one question for you, Mr. Ballotta.
I'm here.
Hello, thank you for a very interesting talk. Can you tell me what has been like the biggest resistance in implementing harm reduction and the gender perspective? Thank you.
Very, very good question. I can tell you what is my feeling, my personal experience. In the booth, in the beginning, 10 years ago, 15 years ago, harm reduction was at this bad reputation of being the backdoor to liberalization, legalization. Not really clear what was something related to, being soft. You have to say the prohibitionist approach, which is you don't take drugs, and if you take drugs, you are penalized, is 100 years old. Harm reduction started in the 1780s. So it took time for people to understand that actually was working. And then only when data were there and they were showing that really HIV was going down, that really people in agonist treatment were improving their life. And there that little by little, helped other people, because harm reduction fight totally compromised the old idea that drugs is evil and you prohibit and people do not take it. A very old traditional way of thinking to drugs. So harm reduction break that a little bit and require a policy of the half tones. It's not white, it's not black, it's gray, it's in the middle. And some people, some countries, also in Europe, have resisted that on ideological basis because they thought it would not give good results. Little by little, it's not one. There are still countries in Europe that have problem with naloxone, take home, for example, because they say, oh, if I give take home naloxone, they will use more. The old mantra of the heroin exchange thing. So it is ideological, and it can be fought, can be convinced through data and through evidence that is working, and is not favoring legalization, liberalization, but is saving lives.
Okay, thank you, Mr. Ballotta, for your input and participating today.
Pleasure. But next time, I hope to be with you there.
Oh, we want to have you here. Absolutely.
Would
You're
be
welcome.
fantastic.
Bye-bye.
Would be fantastic. Thank you very much. Good continuation. Bye.